We are here live in the studios, typically on the fourth Saturday of the month.
Yes.
But we are here on the third Saturday of the month. And by the way, you'll be back with us, Dr. Richmond. It looks like December 22nd. So we look forward to having you back just before Christmas, so we can get those reminders about caring for our feet. And just before the break, we talked a little bit about that. So what are some of the things that we could be doing? Because we also talked before, you've been with us for many years, is that sometimes we just ignore our feet in the shower.
Yeah, well, ignore them, period.
Yeah.
Beyond the shower, the tub,
Just
looking at them.
They're at the bottom, leave them alone.
They just deny they even exist.
What can we do, Doc?
Wash them. Just wash them. Lord, just wash them. I had a patient, I was offering him the foot spa just so he could get his feet washed.
Because you knew they needed some attention.
Oh, they needed a lot. And I mean, it's simple things. Just wash your feet. When you get in the tub or shower, suds them up, wash them, floss between your toes. That's a major thing. Toe jam is not sexy. Toe jam can cause infections because it's almost like a petri dish in between your toes. So you're feeding the bacteria and the fungus that live there. You're giving them plenty of food to live off of because you're not cleaning in between those areas. Lotioning your feet. Like I said before, if lard works, if Vaseline works, cocoa butter, aloe vera oil, if you got a plant, you rub that on your foot. If your skin is beautiful, if it's supple, if it's not cracking, if it's not itching, keep using it. But if you're still using all these different over-the-counter products and your feet are still in bad shape, crusty, dry, cracked, then it's time to come in. Because it could be something else. It could be athlete's foot. It could be like a dermatitis. I'm seeing a lot of eczema this time of year, a lot of psoriasis.
And what do you suggest for treating eczema?
Like eczema, generally it needs like a steroid cream, or there's some new non-steroidals that are on the market. I have a lot of samples of that. And then, of course, we can try and get you some of the milder creams. People who are like the eczema, psoriasis type people, I tell them to use baby products on their skin. So baby body wash, the same kind of wash you would use on your clothes, or use the non-fragrance, nothing added detergents body wash. On your skin, or just use baby body wash because that's for very delicate, sensitive skin. And of course, if none of that works, then it's time to come in. I actually send a lot of patients out, especially if they have systemic psoriasis or eczema. I'll refer them out to a dermatologist so they get their whole body treated, because I can only treat you below the waist, but knee down. So, but at least I can see and get an idea of what it is. I can also do like skin biopsies, take some shaves, send it in and make sure it's exactly what you think it is, so we can make sure what we're treating.
Okay, very interesting. So when we talk about caring for our feet, and let's just say we're home, we need to clip those toenails, how far in should we go?
So if you're diabetic, you shouldn't be clipping your own toenails. If you're on blood thinners, you shouldn't be clipping your own toenails. If you're healthy, just give a millimeter. You don't want to go flush to the skin or to the quick. I mean, if you want, I have some of my type A's, they like their nails super, super low. I mean, you can get out a little distance, and then I say get those big files that are like the square blocks, and then file it as you get closer to the skin so you won't break the skin. As far as ingrown toenails, I do not suggest bathroom surgery or garage surgery, getting things out of your bathroom or your garage to pick at your feet. People have lost toes behind ingrown toenails. It's better to come in when it first happens, when it first starts to irritate you, because we have little tools that we can get down in those corners and cut it back. But of course, if you come in and it's all pussy and nasty and ooey and gooey, generally we do have to take the nail out, and that is an injection, and it is painful. So people always say, does it hurt? I say, yes. But, we're going to get through this. But, to get that infection out, the body now thinks that nail is a foreign body, like a splinter. So until you take that nail out, the body will keep attacking it. And most time when you take it out, they come back in a week, they're resolved. But in some cases, like in my diabetics, it may take longer, especially depending on their blood sugars and their blood flow to their feet. Yeah.
So when we talk about caring for our feet at home before or in between appointments, do you recommend peroxide?
Not really. It's just a sauna for bacteria.
God,
They're just in there bubbling around, having a good time. It's not really killing anything. I mean, you can try it. I say try your little things. But if you're not getting better or you're getting worse, it's time to come in and get possibly antibiotics or whatever you may need. Because that's generally what happens. People keep trying home remedies. They'll go dig up some old antibiotics from 1996. And take them, dig out some old ointment from their cousin or some procedure from 10 years ago, put that on there and pray and hope it gets better.
Grandma says that bag bomb works.
Well, it might, but it depends on what's living on your foot. It depends on your health, your issues. Bag bomb might have worked on grandma, but the bacteria that exists now is not the bacteria that existed when your grandma was alive.
It's an individual basis, huh?
Well, no, we have superbugs now. So we have MRSA, we have VRE, GR. I mean, we have so many different, and then there's some new bacteria. They said they can't even kill it.
Times have changed.
Yes, because of our abuse of antibiotics doesn't work for us because the bacteria is not the same bacteria that was, I would even say 10 years ago. Because bacteria can repopulate itself probably within a couple hours. And then the bacteria that have a resistance pass it to the next set of bacteria.
Wow.
So it passes quickly.
We talked earlier about things that we can pass down to our children, and because your clinic is a foot and ankle clinic, do you treat children?
Oh, yes, 0 to 100 or older.
Older. So
yes.
If someone has a son or daughter that has issues with their feet, they can make an appointment.
Yes. We see a lot of kids. Most of the time with children, you're dealing more with gait problems, walking problems. They're pigeon-toed or they're knock-kneed. Children tend to have more warts, athlete's foot.
And why is that?
They walk barefoot everywhere.
Okay, gotcha.
They're in the, you're going to pee or going to a public shower, all kinds of nasty stuff. And then, of course, with the ingrowns, especially in my boys and my men, they will pick and pick until someone knows their lips off. They're like, oh, you got to go to the doctor. So they may be, they're severely infected. And then as far as the knock knees, the pigeon toe gait, the in toe gait, we have what's called gait plates, which are devices that go in the shoes that can help.
Earlier, even last month, about some of the products and other things that you sell, which you have a line of things that you sell at the clinic. So can you walk us through some of the items that you have? People can buy socks and...
Yes, we have diabetic socks, we have compression socks, we have
And if you can, talk to us a little bit about each and what they do for.
So diabetic socks are socks that allow for swelling in a diabetic. They don't have seams on the inside, so they don't rub you. And then they're made from bamboo. So they allow the socks to breathe better, give you more airflow, especially if you have really sweaty feet. Then we have compression socks, which are not as tight as compression hose, prescription. So if you are, per se, have compression hose and you can't get them on, the compression socks are a good option for you. We have all kind of pads for your hammer toes, your corns, your calluses. We have heel pain sleeves. We also have medicated socks that you can put on to help with moisture on your feet. Different kind of, we have even roll-ons for sweaty, funky feet.
There's not just a roll-on for the underarm.
Yes, there's roll-on for your feet. Yes,
okay.
We have foot sprays that can help with the odor with your feet. We have natural pain creams. That's all topical and natural for any kind of muscle pain.
So for someone that's having light pain in their feet, they can buy the cream.
Yeah, like they're having ankle pain or heel pain, leg pain. You could come and get that. We have antifungal toenail polish that's medicated and colored. So if you want to treat your toenails and paint them at the same time, we have that as well. And we have pumice stones for sale.
What are pumice stones?
So they're like the lava rocks you see in the foot section. That's what you would use on your feet after you take a bath to help get the dead skin and calluses off your feet. And I advise that for all my diabetics to use on their calluses, or people in general use on your calluses between visits, maintenance to keep them down between visits.
Okay. And those rocks, do they come in a bag, a bottle, and how many rocks do you use per foot care?
The pumice stones generally will last a couple months, depending on how often you use them.
So that's what, 1 or 2 rocks, 3 or 4 rocks in a foot bath?
Oh no, you use this on your foot after you get out. It's like a little rock. Okay. Square rock. And then we have some fancier ones that are made out of, I don't know what, but they're real pretty. Pumice stones.
Got some cuties over there. Huh?
Yeah. And then, of course, we have the foot spa as well. Mm-hmm. So you can schedule those. They take about 30 minutes. We're on Black Friday sale, I think, till the second week of January. So you can call. You do not have to be a patient for that. And we also have gift certificates for the foot spa as well if you'd like to give your loved one a nice foot treatment.
And they're only $10.
Yeah, so you could, and our whole store is on Black Friday. We're on 25% off now of the entire store. So if you wanted to come and give a gift pack to your loved one, especially that female that talked about her husband's funky feet, that'd be a lovely gift pack.
Treat your husband for the holidays.
And treat yourself.
And probably treat yourself at the same time because she seemed a little bit frustrated. Bless her heart.
Yes.
So we wanted to do what we could to help her. So we did suggest for her to give you a call and you can walk her through some other things that she can do. So the Black Friday is a Black Month.
Black Month. I'm going with all the other corporations this year. It's no more Black Friday. It's Black Month.
Black Month. So Richmond Foot and Ankle Clinic is located inside of the Dr. Charles Arthur Health Center. And the address is?
1323 West 3rd Street.
The phone number and website?
937-228-3668. Again, 937-228-3668. The website is richfeet.org.
And the hours?
Monday through Friday, about 8:30 to 5. And Mondays and Thursdays, 8:30 to 5:30.
Okay, and so you're closed Saturday and Sunday, of course. So they need to make an appointment during the week. Now, if someone just says, no, I absolutely can't get there, is there a time where you do specialized times after 5:30?
No. I'm thinking about extending my hours, but we did it before and people wouldn't show up. We even had Saturday hours previously, and people just wouldn't show up. And, there's a cost for me opening up because I have to pay for staff, overhead, and people just wouldn't show up. So that was the problem. But it's something we may consider again. But most likely it'll be Monday through Friday.
Monday through Friday. Got you. So what can we expect next month? What do you have for us next month? I know we're getting into, as we mentioned, we'll be deep into the winter season. I'm sure we'd have some snow by the time you come back. So tell us in preparation what we can be doing to care for our feet.
Probably wearing some good snow boots, boots and shoes with traction. Because we're about to start hitting ice and things like that, and being careful and looking down a lot. I mean, when I walk, I generally just look down. I'm watching the pavement. I don't want to trip, fall, sprain my ankle, and because I see tons of ankle fractures, and people with chronic arthritis where they broke their ankle on ice. Not being careful, and especially my older patients being careful because, for them to break something, it could be catastrophic, especially if they break a hip, a knee, or a pelvis, or hit their head. So mostly now going into the winter months is making sure you got a good pair of shoes with good traction. This is not the time to be cute. This is the time. Yes, it's time to wear some boots with some good tread. So if you're walking out, you're looking and making sure that there's no black ice or ice. You're looking down, making sure there's salt, because once you break an ankle, it'll never be the same.
And so arthritis sets in. What do you recommend for that?
Generally it depends on the level. Most of the time we're talking about a soft ankle brace, but if their arthritis is severe, we're talking more about custom-made ankle braces, and ankles can be replaced as well. So, but that's way down the road with severe ankle pain.
I see. And then, of course, you said replace. Would that require surgery?
Oh, yes. That's major surgery.
And what's the process of that?
You're put to sleep. They actually cut out the old ankle joint and put in a new one, just like in a hip or a knee. And they put a brand new ankle in. But you're talking about recovery time, probably up to a year. It's probably physical therapy. You probably could go back to work if you're sitting, but I don't know, it's like manufacturing, probably not. because you're looking probably about 6 months to a year recovery time from something like that, because that's major surgery.
Your music bed for your show is "Step in the Name of Love."
Yes.
So how can we, in your closing comments, how can we step in the name of love for the rest of this weekend and next week? So help us, Dr. Richmond, to step in the name of love.
Just be, don't ignore your feet. Acknowledge you have them, especially if you're diabetic. Your feet are now high risk. You have to accept that. Accept it, claim it, whatever you need to do. But you need to make sure you're wearing good shoes. Like I talk about the tread on your shoes. We're going into ice and snow season. Make sure your feet are warm. Make sure you're moisturizing your feet, and don't put it between your toes. Don't ignore your feet. If your feet stink, something ain't right.
Don't just ignore that.
Don't just ignore the funk. Something's not right.
So your body's trying to tell you something.
Yes, he's trying to tell you something.
All right, Dr. Richmond, any other words for us today?
Take care of your feet.
Okay.
You only got two.
Only got two.
You can get replacements, but they're made out of metal or plastic.
Dr. Richmond, we thank you as always. We always get a wealth of knowledge of what to do
Yes.
and how to care for our feet.
Yes.
You are our local podiatrist and foot specialist, and we thank you for being with us.
Oh,
once a
thank
month
you.
here on
Thank
WDAO.
you.
And once again, Dr. Tanisha Richmond can be reached at Richmond Foot and Ankle Clinic, 1323 West 3rd Street, inside of the Dr. Charles R. Drew Health Center. You can also reach Dr. Richmond at 937-228-3668. That's 937-228-3668. And her website is richfeet1, and that's the number 1, at gmail.com.
And I'll be at the Indulge event. It starts from 2 to 8 at the new fairgrounds. We're going to be inside and warm in a brand new building.
All right. Well, thank you so much for being with us. We appreciate all you do for the community, and we'll look forward to seeing you December 22nd.
All right.
Have a great day, Dr. Richmond.
Oh, you too.
Bye-bye.
And Dayton.
All right, Dayton, you heard it. Step in the name of love. Step in the name of love, Dr. Richmond says. And we thank you for listening to WDAO AM 1210 and FM 102.3. Keep listening and feeling the rhythm. And, of course, you can visit our website